For human spaceflight, I think everyone understands there are any number of health and medical and performance risks that crews face when they go into space. And the human research program, that's their focus, is trying to understand those risks and then mitigating those risks. As we've done research over the last 20 or 30 years, we've been very successful in mitigating a number of them. Yeah, there's always more to understand, so we can refine how we mitigate them. At the same time, now there are still risks that we don't have our arms around, and there's still issues. Clearly, the most important risk that still needs to be mitigated is radiation exposure, and it's something that a lot of effort is going into in the medical research program as well as engineering in terms of trying to decrease radiation exposure, particularly when you go beyond low Earth orbit. So that's a risk, and quite frankly, could be a limiting risk in looking at space exploration. As we've gotten more experience in long-duration space flight, for example, a new risk that emerged just within the last 10 years, once we started flying people for more than, say, a week or two on space shuttle, instead looking at 3 to 6 months on space station, there's a new risk that has emerged related to visual acuity, and that there seems to be an impact on the visual system after long-term exposure in microgravity. So, and that too is a major issue because we don't fully understand it. It's a new issue. The problems with that relate to structural changes in the eye that seem to be might be related to increased pressure in the brain that occurs in microgravity. So there's structural changes, but importantly, there are functional changes where there's actual changes in people's visual acuity. Someone who might not have needed glasses when they first went up into space now needs glasses. In some cases, while the data is still being collected, we don't know for sure. There may be instances where some of these changes may be permanent. We don't know yet. So there's new risks that are emerging as we get more experience in long-term spaceflight. And again, the research program that looks at the biomedical risk has to be flexible enough to investigate any new risks. While at the same time, like I said, we've been able to retire some of the risks because we've done a lot of research on that. A good example of that is muscle atrophy and bone demineralization. We can control those pretty well now with exercise protocols. The issue there is that while we can control and lessen the amount of bone mineral density that's lost by the astronauts and allowing them to keep their muscle strength up, because muscle atrophies in space, is it takes a lot of exercise. Right now on the space station, each crew member, I think, is exercising 2 hours a day. So while we know what we need to do to lessen the risks of muscle atrophy and loss of bone mineral, right now we're not perhaps as efficient as we'd like. So that research has to continue so that perhaps we can get the same effect we're getting with 2 hours of exercise with maybe, a half hour of exercise or an hour of exercise, because that's a big hit on crew time to have to exercise, but that exercise is necessary. So there's always opportunities for refinement and to learn more about these risks.